Good evening. I'm Susan Beck, the Associate Chair for Academic Affairs. In 2004, Dr. Lee McLean formed the Departmental Academic Affairs Committee, and she charged us with developing policies for reviewing courses and curriculum changes. That turned out to be visionary because in recent years, the university adopted a new curriculum inventory management system, and it requires a curriculum committee approval as the first step in making course changes or creating a new course. Our committee also established some departmental policies, including an appeals policy and a policy for independent study courses. For policies that have a significant impact on students' status, like the appeal of a dismissal decision, it has been beneficial to have a departmental committee review the case and make a recommendation to the chair. I want to thank all the members of the faculty who've served on this committee. Here are some of the former members of the committee, and here are the current members. By working together on policies and sharing our experiences and expertise with one another, we have made all our programs stronger. On behalf of the Academic Affairs Committee, I want to congratulate the Department of Health Sciences on 50 years of dedication to academic excellence and integrity. Thank you.
As the Associate Chair for Clinical Services for the Department of Health Sciences, I'm privileged to work with an amazing group of clinicians and staff who tirelessly work to serve our community through high-quality patient care. The Department of Health Sciences has always been closely linked to serving the community through patient care. Over the years, the physical therapy services have been in 3 locations before settling into our current home on Oakdale Drive in Hillsborough. While the Hillsborough locations have been the hub for our physical and occupational therapy services, we've also provided services at ACOG Family Medicine, the Orange County Sportsplex, the Seymour Center, and the Family Medicine Center at Durham. The Division of Speech and Hearing Sciences began providing clinical services to support the audiology training program when other clinical sites wanted students only after they had already had in-house clinical training. After beginning in the wings, we moved to the current location in Chapel Hill at the Hearing and Communication Center. In addition, services are currently also provided at the Orange County Sportsplex, local assisted living centers, senior centers, schools, and within business and industry. Over the decades, countless patients have been cared for, hundreds of students mentored, and numerous research studies conducted within our clinical practice. We're thrilled to continue to have a thriving clinical practice that serves the needs of the people of North Carolina while also supporting the academic and research mission of the university.
Hello, my name is Debbie Gibbons, and I'm the Associate Chair for Faculty Affairs. And my role in the department is to chair the Appointments, Promotion, and Tenure Committee, and also to facilitate faculty development. I was drawn to this role this year, much like my motivation for becoming a physical therapist. Simply put, I like to see people achieving their goals and feeling rewarded for doing so. However, most people need to feel that there is a coach in their corner and to understand the rules of the game. That's where my extensive experience as the division director in one of the largest divisions of the department, the Division of Physical Therapy, and serving on promotion and tenure committees for over 20 years is helpful. I see faculty development as the piece that helps faculty gain the skills to pursue their goals successfully. I see my office as a place to provide advice of the expectations for promotion within the department, School of Medicine, and the university at large. I work to develop, update, and communicate the procedures to guide our faculty through the appointments and promotion processes. And with such a great faculty in this department, my job is pretty much going to be and is an easy job to do.
Hello, I'm Sue Coppola, and I'm here to tell you about the Department of Health Sciences International Committee. The UNC Department of Allied Health Sciences and now Health Sciences has enjoyed international partnerships for decades. In 2018, Dr. Hooper determined the need for a committee of representatives from each division and center to come together to highlight and advance our global connections and partnerships. We began by setting a vision statement as follows. The UNC Department of Health Sciences is committed to health and well-being, focusing on North Carolina and extending globally. We value learning and scholarship that arises in international engagement and seek opportunities to build a global mindset for faculty and students. We work through international partnerships built upon mutuality, cultural humility, and sustainability. Our committee conducted 2 surveys of faculty international activity, one for 2017 to 2019, and then another from 2019 to 2021. In the first study, our faculty had collaborations in 20 countries, and then in 2019 through 2021, during the pandemic, that number increased to 22 countries, with many of the collaborations being virtual. This map shows you allows you to visualize the partnerships, reach, and importantly, the global mindset in the department. Finally, I'll share a quote from one faculty member from a survey. Global engagement stimulates new thinking and broad collaborations that can lift the quality of practice in many ways. Thank you, and please join in our global mindset.
In the last several years, our department's involvement in interprofessional education and practice, or IPEP, have grown tremendously. Faculty, staff, and students have worked tirelessly to develop educational and clinical learning opportunities. We are also a member of the UNC Office of IPEP and participate in learning activities across campus. In 2021, our efforts were recognized when we received ASAP's Award for Institutional Excellence and Innovation in IPE and Collaborative Healthcare. We remain dedicated to training our future health professions leaders in best practices of IPEP to provide quality care across our communities.
Hello, my name is John Gross, and for the past couple of years, I've been the Associate Chair of Research and Scholarship here in the Department of Health Sciences. However, I've been involved in research at UNC Chapel Hill for well over 30 years, so it seems appropriate in the context of our 50th year anniversary to delve into the research archives and tell you about a study that was done here many years ago. The study I want to tell you about was done by Joe Hall and Bob Peters and was published in 1981. The title of the paper is Pitch for Non-Simultaneous Successive Harmonics in Quiet and Noise. Now, when I came to Chapel Hill as a postdoc in late 1986, it was to work with Joe Hall, who had just joined the faculty here earlier that year. Joe had already established himself as a world-renowned auditory scientist from his previous work at the Institute of Hearing Research in Nottingham, England, and then later at Northwestern University. Bob Peters was still here as a senior faculty member, and Bob had arrived at Chapel Hill in the late 1960s to start the speech and hearing program, which at that time was its own institute. Now, Joe and Bob had worked together prior to Joe's arrival here as a faculty member in '86, because Joe had done his clinical audiology degree back in 1980. Joe had arrived at that clinical degree in a somewhat circuitous manner, in that he'd already done a PhD at University of Greensboro, followed by a postdoc at Duke University, before coming to Chapel Hill to do his master's in audiology. So it was not surprising that Joe brought research interests with him when he came to do his clinical training. So Joe and Bob would tinker around in Bob's lab during that clinical training. Bob's lab, as was the whole speech and hearing program at the time, was located in the basement of Wing D, which is that old brick structure behind the hospital complex. The basement of Wing D was always dank and musty, and if I'm correct, lacked a central air conditioning system in those days. So it was not unusual for individual offices and labs that had exterior windows to have window-mounted air conditioning units. And Bob's lab had one of these air conditioning units in the window, which periodically kicked on and off during the day. The topic that Joe and Bob were interested in studying was pitch perception, specifically the pitch of harmonics that were presented sequentially rather than all at the same time. And they noticed that the pitch percepts of these sounds changed depending on whether the air conditioning unit was on or off. When the air conditioning unit was off and the room was quiet, they heard the individual pitches of each tone in the sequence. However, when the air conditioning unit was on, providing a background noise, they heard instead the pitch of the fundamental frequency of the harmonic complex as a whole, even though the individual harmonics were presented sequentially. So they switched gears and began to study the effect of background noise on pitch perception for non-simultaneous harmonics. And this paper is the result of that investigation. So what can we learn from this brief delve into the history of research in our department? Well, first, pay attention to the oddities in your data, because sometimes it's the oddities that provide the most important and interesting findings. Second, in rare instances, scientific discovery can actually rely on suboptimal lab conditions. But most importantly, we've learned to be appreciative of the faculty that have gone on before us and who, despite limited resources, have made great accomplishments and have helped make this department the wonderful and renowned department it is today. Thank you.
Hello, and welcome to the 50th anniversary celebration of our department. I am excited to be able to share with you today. My name is Brenda Everett Mitchell. I am the Associate Chair for Student Services and AHEC Operations in our Department of Health Sciences. I've been here for a number of years, and as we think of celebrating, I am reminded that we stand on the shoulders of many giants who came before us. So I'm delighted that you're sharing in this monumental event with us. I want to just share a few highlights of things that I've been intimately involved with over the last few years. One being our Student Ambassador Program. It has grown from a few students when we started back in 2002 to we have about 35 active student ambassadors who plan events and recruit other students and participate in many events that will heighten awareness and collaborations between students, faculty, and staff within our department and in our community. I'm also excited about our JEDI team. We've had a diversity-focused team throughout the years, but recently we've become known as the JEDI team, which stands for Justice, Equity, Diversity, and Inclusion. And we are addressing issues related to those topics and our professions. And so we have a wonderful dynamic website. We encourage you to go there, see some of the articles and some of the other priorities that we've indicated on that website. We will be embarking on a social justice curriculum soon that will be infused within all of the curricula that we have within our department. In addition, we have monthly community conversations, which were started a number of years ago, and we are able to address topics that are controversial, topics of interest to many people, so that we can have the perspectives of one another as we journey together. We have a number of new programs and initiatives, and our division directors will share those with you. But again, I just thank you for the opportunity to welcome you to our 50th anniversary celebration.